Hi everyone, my name is Ruth Plackett. I'm an NIHR SPHR Postdoctoral Launching Fellow based at UCL. And I'm going to give you a brief presentation today about how I found my public health practice placement and my experiences so far. So first I'm going to talk about how I actually secured my placement. And I think the first thing I did was obviously think about what I wanted to get from the placement. So I'm not from a public health background, so the placement in itself would provide me with a lot of great experience in public health, which I obviously didn't have. So that would be a huge bonus for me. I also definitely wanted it to be in public mental health, as that's where my current research interests lie. And I think I just wanted it to help me widen my network and improve my connections with those who work in practice as well. So I think the first step in this journey of kind of finding a placement was to really just ask around quite informally to start with, particularly with your colleagues and people who are also pre-doctoral fellows and postdoctoral fellows within SPHR, some of whom you may be aware are also public health practitioners. They can offer some really good advice on what might make a good placement, where might be good to go, and have some good connections of their own with different organisations. I also spoke on our kind of weekly catch-up meetings with SPHR based at UCL. So I spoke with the professors involved about people that they've worked with in the past, public health, like local councils and things, and Public Health England, and any contacts that they might have and experiences they might have that might be able to help me find suitable placement. So obviously they know your research interests and your skills and your needs, and they can perhaps nicely align that with someone that they've worked with before. And actually based on that, I was recommended to speak to my mentor, who was based in Bristol and not at UCL in London, to kind of get a wider perspective on this and see if they knew anyone or knew of a placement that could be appropriate for me. So that was the next step for me. So in one of my regular mentor meetings, I asked my mentor if they had any connections or advice on a public health placement even. And we had a very open conversation about it and discussed lots of different ideas. So she was aware of a fellow who was doing a placement in the charity sector. So that's also another option you could consider. I didn't go for this option as this is a sector I already had experience of working in. And I think working in a sort of public health local government organisation would give me a better and a more different perspective than what I'd already had experience of. And she mentioned that she had quite a close connection with a public health practitioner in South Gloucestershire Local Council, who was the head of the public mental health and wellbeing team, and suggested that, you know, obviously she knew they were a great person to work with and thought that their interests would align with mine, and suggested that she could put us in contact with each other. And so and she did this, and we contacted each other via email to begin with, and then the final stage was really just speaking formally with the public mental health lead at South Gloucestershire, and just telling them a little bit about what the placement might look like and what my kind of learning objectives and needs would be, and hearing from them what kind of help that they might need right now and what kind of projects they're working on, which I thought sounded great and aligned with my needs and my need to get more experience in public mental health. And the process was really quick after that. I think I spoke to his senior managers to get sign off for me being able to do the placement. And as soon as that happened, within a few weeks, I started the placement. So the placement I am doing is a remote placement, and as I said, it is in South Gloucestershire and I'm based in London. So this works out quite well for me. I think it's a bit more feasible to conduct a placement in a different area if it is remote. And obviously it's remote because of COVID reasons as well. But it does have some advantages, I think. There are obviously some disadvantages as well. Obviously you can't be quite as connected with the organisation, but so far I've found it to be quite helpful. We communicate really well, and I've met a lot of people, obviously, via Zoom and Teams, but still had made some really good connections there. So the structure of my placement is I'm doing around 3 months, around 2 days a week, but I say around because it is very flexible. So we're taking quite a flexible approach. This is in part to take into account the nature of public health research, being sometimes you need to really rapidly turn some work around. So you may need to dedicate more than 2 days a week every now and then to make sure things get done, and also to take into account of my workload. So for example, if I get an article back that's sort of revised and resubmit and it needs to be done quite quickly, then I can respond to that as well. So we're both quite clear about we're going to be responding to each other's workloads, and you know, obviously making allowances for different timelines. So the structure as well that we've decided to go for is that I will I will not necessarily lead any projects, but I will be involved with a variety of different projects that are at different stages, so that I get a broader variety of experience of what goes on in public health. So some might be evaluation projects, some might be implementation projects. And one of the ones that I'm currently working on is a funding bid for post-pension suicide bereavement services that's being developed with South Gloucestershire, North Somerset and Bristol. So it's great to be involved in that and see how research contributes to funding bids and how all the different local councils work together, and also get experience of that quite tight turnaround in terms of timescales. I'm also doing a lot of shadowing strategic decision-making meetings, which is really helpful. And one of the aims of my PhD is trying to understand that kind of decision-making process, understand how things get commissioned and funded. So my experience so far has been pretty good, actually. I'd say there's definitely more benefits than challenges to it. You know, as I said, I've been involved in lots of different projects and understanding how decisions are made. I'm also getting a little insight into what a career in public health might be like, although this isn't necessarily something I'm seeking or was seeking to understand, but it has given me that insight, which I think is useful if I want to explore any other career opportunities later in life. It's also really given me insight into some of the challenges of implementing interventions in practice. You know, one of the things I've been looking at is identifying mental health needs in schools, which has been quite challenging. And I think that's something in my future fellowship applications that I might now be able to provide a better account of and consider a bit more, and be able to really create a stronger application to show that I've considered all the difficulties and challenges of implementing interventions in schools, for example. And as I said, I think it really has improved and widened my network. It wasn't something I was particularly expecting to gain contacts in South Gloucestershire, but now I feel like I've developed really good relationships with them and hopefully can work together on something again in the future. I think the main challenges are just really balancing that workload, particularly if you're doing it part-time like I am, just a couple of days a week. It can be quite challenging to sort of plan and figure out what kind of work you're going to do when. I think, yeah, part of one of the challenges related to that as well is that because we're remote working, the communication can be sort of less effective and less easy than it might be if you were in the same office. So it's not always as easy to come to kind of decisions together and inform people of what's going on when. So in a related note, I do have some top tips for undertaking placements remotely, so from what I've learned. And I think that's the communication part is the key one, I guess I want to emphasize, is that you do need to be quite communicative over email and video calls or voice calls or whatever you do on Teams and Zoom, to keep each other informed of what you're doing, what your workloads are like that week, what's coming in from your end, what's coming in from their end, and so you can decide together what you're going to work on that week or not work on that week. And I think it's ideal to be really flexible in your approach. We've taken a flexible approach partly because of the nature of public health work can be very busy. Some weeks working on one thing and less so the next weeks, and the same is true in academia as well. So it's just trying to communicate clearly with each other and flexibly fit with each other's needs, I think. One of the things though that can help is to be, to plan quite effectively what you're doing. So whether it's just organizing your calendar and diary so that maybe you have, you're working Mondays and Fridays on your public health work, and you try and organize your meetings and things like around that, or whether you disperse it through the week so that you're able to really flexibly attend different things, and that can also be really helpful. And you may also decide that you want to take the placement full time so that you can fully dedicate yourself to to some projects, and maybe even lead some public health projects, which I think would also be a really great idea, and is something, given my structure, I haven't really been able to do. So there are lots of different models and ways you can do it, and it just involves just some communication to try and understand what would fit your learning objectives and needs, and what would benefit them as well. So thank you for listening, and good luck with finding your placements and on your placements as well. If you do have any questions or anything you'd like to ask about my placements or how I found them, you can email me, and you can also message me on Twitter, as you can see the addresses on screen there. So thank you very much for listening.